Okay, so in this will explain everything. We're looking at dot points 5, 6, and 7. More specifically, we're looking at the factors that contribute to the development and progression of mental health disorders. So we're looking at biological, psychological, and social risk factors. So this particularly explain everything. The reason why I'm doing it this way is because it would just take way too long in class just to run through all the factors. And to do it justice, it's probably done much better via and explain everything. So what I'll get you to do is just watch this through and please watch it properly and watch all of it and just make sure you get all those notes down from the document that I've given you in class. So this is really coming off the back of the 4Ps model. So remember we're talking about predisposing factors, precipitating factors, perpetuating factors, and protective factors. Now, each of these 4Ps can be subdivided into biological risk factors, psychological risk factors, and social risk factors that, as we know, interact and combine to influence a person's mental health. Now, we have to understand that mental health and mental illness or disorders are best understood by considering how specific factors from within each domain interact and cause illness. And that also helps us to treat those illnesses as well. So what we're looking at in this little, or in these 3 dot points, I should say, is we're looking at how all of these things combine and interact to allow us to understand illness a little bit better. Now, with each of these, risk factors that I will be presenting to you, they will also fall under some of the 3Ps, so predisposing, perpetuating, and precipitating risk factors. So let's start with biological risk factors. So these are factors that originate within the body and are usually outside of our control, so they're internal. What that means is we can't necessarily do very much to control these particular risk factors. Now, what you can do is you can use this little acronym here to help you remember the specific risk factors that are biological. So we've got GUM. So GUM stands for G is for genetic, M for medication, and S is for substance use. You can think of a horse's gums. So for biological risk factors, we have 4 specific factors that we're looking at. One of our first factors is genetic vulnerability. So genetic vulnerability is having a risk for developing a specific mental illness due to one or more factors associated with genetic inheritance. So what we're looking at here is nature. Now you looked at this stuff in units 1 and 2. So you might, for example, inherit your eye color from your parents. You might inherit things like some parts of your intelligence or your athletic ability. Very, very similarly, we can also inherit a predisposition or increase the likelihood of developing a mental illness from genes or genetics that we inherit from our parents. What this means for us is that this can make people more susceptible, or it can increase the likelihood of us developing a mental disorder. However, it does not guarantee the onset of a condition. What I mean by this is that, so for example, in my family, there is a history of depression. So what that means for me is that I have an increased likelihood of developing depression than somebody who doesn't have that genetic predisposition. However, unless there are environmental factors that occur that set me up for having depression as well, then what that means is that I won't necessarily get depression. So even though I have a likelihood of getting it or a higher likelihood of getting it, it doesn't necessarily mean I'm actually going to get it. Another example that we can look at is schizophrenia and the relationship with genetics there. What we can see is this graph is that the closer the degree of genetic relatedness to someone with schizophrenia, the greater likelihood of having or developing schizophrenia. So we can see here, if you're an identical twin, then you have a 50% likelihood of developing the disorder. If you have 2 parents with schizophrenia, then you have a 45% risk chance. If you have 1 parent with schizophrenia, you've got 17%. So what we can see here is that if you have someone who you're related to that has schizophrenia, you're much more likely to get it than if you had no parents who had schizophrenia. However, that doesn't necessarily mean that you're going to get schizophrenia. Generally, this vulnerability is influenced by lifestyle and environmental factors. Okay, so our second factor that is biological is poor response to medication due to genetic factors. So, people who have mental illnesses often take psychotropic medications. These are primarily used to control the onset or severity of symptoms so that the individual can function more effectively in their environment. What this actually means is that symptoms are alleviated or reduced or inhibited, however, they do not cure the underlying condition. Studies have shown that these psychotropic medications are not necessarily effective for everybody, and that some people often find that there are quite a lot of side effects associated with medications, like weight gain, like headaches, and things like that. Several studies have proven or have shown that medications are not necessarily very effective depending on your specific kind of genetics. So they found that up to 45% of people suffering from depression show a very poor response to antidepressant medications, and about 50% of people who have schizophrenia are only partially responsive to antipsychotics. So what that means is people are taking these medications and they're not necessarily targeting their symptoms or reducing their symptoms as well as is being thought, I suppose. So they're not actually working. Studies have, I suppose, they've looked into why that might be. And what they found is that there are differences in people's genetics, and they lead to differences in processing those prescribed medications. What that can actually mean is that your particular kind of genetics can affect the absorption, metabolism, and elimination of medication. And what that means is that the symptoms that you expect to be reduced, that's not actually happening. So these symptoms are being untreated. So there are three things that can actually happen depending on your genetics. So the body may metabolize or break down a particular medication too slowly. And so what that means is that the medication will build up in the body, and that can cause severe side effects. The body may metabolize the medication too quickly, and so it reduces it or gets rid of it from the body before it can actually work effectively. So you're not actually seeing those symptoms, or that there are significant or undesirable side effects from the medication. So the first two are the most important. So there's a build-up, and so you have your side effects, or the drug is eliminated too quickly from the body, and so you don't actually see those particular reduction in symptoms. This is not to say that genetics are the sole reason why medication is maybe not being super effective. There are other biological reasons such as your age, your gender, your body weight, your race, your diet, and other coexisting disorders. There are also psychological and social factors that could also affect the responsiveness of medication. However, in saying that, we're looking at genetic factors, so you should really only respond to those particular factors in a VCAR exam. So our third biological risk factor is poor sleep. Sleep is essential for replenishing the body and the mind. Now, you'll learn more about this in our next unit, so states of consciousness. Poor sleep quality or quantity is associated with a range of mental disorders. So what we found is that if you are partially sleep deprived for a long period of time, so if that sleep deprivation is chronic, it can actually lead to things like mood disorders, anxiety disorders, addictive disorders, personality disorders, and schizophrenia and other psychotic disorders. This is considered a risk factor for the development or progression of certain mental disorders. So we're not just talking about one thing, we're talking about developing it and actually the progression or the perpetuation of a existing mental disorder. Because of this, we consider sleep to be a bi-directional relationship with mental illness. So what that means is it's two-way. So it may actually contribute to the development of a mental illness. So there's evidence to suggest that people with insomnia have as much as a tenfold risk of developing depression compared to those who sleep well, or it may also exacerbate the experience of a mental disorder. So many people with anxiety disorders get really poor sleep because they have a lot of anxiety about things going on in their life or even not being able to go to sleep. So it's actually really hard to isolate the cause from effect when we're looking at the relationship between poor sleep and mental illness. What we do know, though, from I suppose research into sleep is that it's really important that we are getting sleep. And if we are not getting sleep, regardless of if it's causing a mental disorder or a mental disorder is causing the lack of sleep, is that our restorative functions that influence mental health are being disrupted. Okay, and our fourth biological risk factor is substance use. Now, when we talk about substance use, we're talking about the use of legal or illegal drugs. So we're talking about things like alcohol, tobacco, prescription, non-prescription, over-the-counter drugs, marijuana, heroin, ice, etc. What research has found is that there is a bidirectional relationship between substance use and mental disorders. So about 50% of people who have severe mental health disorders are affected by substance abuse. Because the relationship is bidirectional, as I've said when I've talked about sleep, causality is really difficult to establish. They found that people who regularly use or abuse drugs or other substances are at a much higher risk of developing a diagnosable mental health disorder. So, for example, people who are diagnosed with a substance use disorder are twice as likely to suffer from mood or anxiety disorders. However, there are active ingredients in drugs and alcohol that directly contribute to the development, onset, or maintenance of illness. So, what this means is that often people take drugs as a way to self medicate. So, drugs are often used to mask the symptoms of anxiety or depression. However, these symptoms also interact with medications and make them less effective. One model that is used to, I suppose, to describe the relationship between mental illness and things like drug abuse is this thing called the two-hit hypothesis. So the two-hit hypothesis. So the two-hit hypothesis suggests that the development of illness can be explained by two hits. So one hit will occur in vitro, so when the infant or the child is developing in the womb, and that will increase vulnerability to an illness. And then an environmental factor will be the second hit. So what they suggest is that there might be some disruption in brain development through things like gene deficiency, disruption to the fetus, and that's like the mother getting sick or the mother ingesting things that she probably shouldn't be ingesting when she is pregnant. And so that will mean that there is a disruption to development, and this increases the vulnerability to mental illness when the child is born. This doesn't necessarily mean that the child is going to be mentally ill when they are born or later on in life, but what needs to happen is there needs to be a second hit. And so that might be drug abuse. It might be a social factor like the death of a loved one or abuse. And that leads to the second hit. And what that will eventually do is it will culminate and it leads to mental illness. So what we're looking at here is a combination of factors whereby there has to be genetic vulnerability, but then the active ingredients in the drugs is that second hit, which leads to illness. Now, in the case of the bidirectional relationship between drugs and mental illness, yes, certainly drugs can or substances can cause mental illness. However, what we find is that because people tend to self medicate with drugs, it's really quite hard to see or separate when the mental illness is developing and when the drugs started being taken and things like that.